Welcome to another episode of Boom and Bust. I'm your host, Tony Clement, here at the News Forum where all voices matter. Recently, secondstreet.org, a new think tank, commissioned a public opinion poll on Canadian attitudes towards health care reform, and there are a lot of insights. Here to discuss is Colin Craig. He is the president of secondstreet.org. Colin, welcome back to the program.
Well, thanks for having me, Tony.
First question, are healthcare wait times and the current perilous state of those a pandemic issue, or is it also a pre-pandemic issue?
I think the evidence shows that this is a pre-pandemic problem. The pandemic has made a bad situation worse, but we have seen over the past 30 years, government spending on healthcare has increased substantially at nearly double the rate of inflation on a per person basis. And at the same time, some very good research by the Fraser Institute shows that waiting lists have also increased. So governments have spent a lot of time increasing spending and hoping that it would turn things around, but unfortunately that just hasn't worked. So that was a growing problem before the pandemic. Then the pandemic came along and it made things worse because, of course, you had a lot of people being admitted to hospitals for COVID, and that was pushing back surgeries. Governments had to postpone all kinds of different surgeries across the country, all kinds of other medical appointments, and so forth. So it's been a growing problem, and one other major issue that has impacted the situation is, of course, that we have an aging population.
Right.
And it's just a fact of life that as we all get older, we tend to rely on the healthcare system more. So it's certainly been a growing problem for a long time.
Have different provinces been able to weather this storm better than other provinces?
I think we've seen some encouraging results in different parts of the country. Saskatchewan, they've been experimenting more with working with the private sector to help reduce waiting lists. We've seen some positive changes there. So I think it depends on which part of the country that you're looking at. Atlantic Canada, in particular, has been it's been a hard go of it for patients there. It seems like there's a lot of unfortunate news stories coming out of Atlantic Canada when it comes to patients dying on waiting lists, not having access to a family doctor, long waits for surgery. So it depends on which province that you're in, but I think on the whole we still need health reform across the country.
Yeah, and just getting back to the pandemic and its impact for a second, different provinces had different levels of sort of how they reacted to the lockdowns and vaccine mandates and so on. Did your research show any differentiation that way in terms of whether their pandemic response had a deleterious effect?
That's a good question. I'm not sure is the short answer. We've certainly seen some sad stories coming out of different parts of the country, because what we did see across the nation was governments postponing different surgeries and operations, and some were a little bit more aggressive than others, but that's had an impact coast to coast because, like I said, waiting lists were bad before the pandemic. The pandemic has made things worse because of how governments have postponed these different procedures and that. So we're really in a situation now where we can't think that this is just a short-term problem due to the pandemic. We need systemic reform. One thing that we noticed was we had gathered some data from Ontario Health, which looked at the number of patients that had died while waiting for CT scans and MRI scans. And leading up to the pandemic, it was growing every single year. And then, of course, the pandemic hit and it just kept growing. So, there's certainly lots of evidence that this has been a system that has needed reform for a long time now.
So before we get to discussing the results, you did a poll of what exactly? Who did you poll?
It was conducted by Leger, and they're one of the most reputable and accurate polling companies in Canada, if not the most accurate. And we polled Canadians, about 1,500, asking them about several different healthcare reform measures in terms of service delivery, and one question related to just improving accountability in the healthcare system.
Good stuff. We are going to talk about that. I think we're going to leave that to the break because I think this is kind of the meat and potatoes part of the program where you talk about your results. We are here with Colin Craig. He is the president of secondstreet.org. which is a relatively new think tank in Canada doing some good work. We'll be back after the break with some more interesting details of their polling results. Please stay with us. Welcome back to Boom and Bust. I'm your host, Tony Clement, here with Colin Craig, president of secondstreet.org. Colin, what did your research show in terms of attitudes in the present day to healthcare?
Yeah, so the public opinion research, I think, shows that Canadians are ahead of elected officials when it comes to health reform. The three polling options, or the three health reform options that we polled Canadians on, it showed that Canadians majority support moving forward with these measures. So one of which was pretty simple, and that was this notion of keeping our public universal healthcare system, but allowing patients to spend money at private clinics for procedures if they don't want to wait a long time in the public system. And 51% of Canadians agree with that option. They think that that's something that the government should move forward with. And if you think about it, when you look at other healthcare systems around the world that are universal, they don't do it the same way that Canada has. We have a monopoly, essentially, in many ways, for government over healthcare services in this country. And so that forces everyone to use the public system. It puts a lot of pressure on the public system. And countries that outperform Canada, countries with universal healthcare systems, they give patients a choice. You can use the public system, or you can go to a private clinic and use your own money and pay for it. And so what that does is it takes pressure off of the public healthcare system. And so if you're on a waiting list for the government and someone ahead of you decides, well, they want to pay for it and maybe get it, in a week or two or whatever, well, that's great for you too, because you would still get it through the universal system. But now that this person ahead of you is using a private clinic, well, you get to move up a spot in line. And so that's one of the major benefits of this approach. And it's been done successfully in countries all over the world.
Mm. And what about private providers in the public system? So you get to still use your OHIP card or whatever health card you have, but it's the private providers who are providing the service. Did you poll on that?
Yeah, we did, Tony, and it shows that 64% of Canadians think that that's a good idea for governments to work with the private sector to reduce waiting lists. And if you think about it, we keep hearing from governments that they just don't have the capacity right now to expand the number of surgeries that are being done too much. We've heard that comment from government, and so if they hire a private clinic that can do it, well, then that's great. Because if you think about this from the patient's perspective, what do people generally want when it comes to getting their hip surgery or their knee surgery or something else? They want to make sure that it's done right, right? I mean, no one wants to have an infection or find out that there's a problem or whatever. They want it done right. And so when you have a private clinic, they have to follow the same standards that the public system meets. I would say the second thing that patients want to make sure happens is that they get that surgery done in a timely manner. No one wants to be sitting on a waiting list waiting for months on end, living with chronic pain, popping painkillers, watching life pass them by. So like I said, when you hire private clinics, it can help reduce wait times because you end up with more supply helping the public rather than less. And I think the third thing that Canadians are most concerned about is that when they get their knee operation or their hip operation or whatever, they don't want to walk out of the clinic and have to pay a big bill for it. And so when governments have used this approach, what happens is it's just like visiting your family doctor. You go in, you talk to your family doctor about maybe a cough or a sore shoulder, or whatever it is. And when you leave, you don't pay a bill. What happens is that doctor's office bills the government, and the government pays for it, of course, through the taxes
Right.
that they collect from all of us. So I think Canadians understand that this is it's an effective way to reduce wait times. It can be cost effective too. That's what Saskatchewan showed when they moved forward with working with the private clinics quite aggressively back in 2010. Fraser Institute analysis showed that it reduced expenses by about 26%. So it can be a very cost effective decision for governments too.
In a sense, you're right, this is nothing new. It's been part of our system. And what advocates are saying is it should be expanded, right?
Yeah, exactly. And as I just mentioned, it's for decades Canadians have gone to their family doctors. Those are private businesses, and like I say, they're funded by the government. Every time a patient comes in, that family doctor will bill the government for the visit. So, a lot of parts of the healthcare system are actually operated this way. Sometimes when you go to get your blood tested or maybe an MRI scan, sometimes those are actually run privately, but they bill the government to pay for the procedure that you receive.
We're speaking with Colin Craig. He is president of secondstreet.org, talking about a recent poll that they had conducted on Canadian attitudes towards healthcare and healthcare reform. We can take another brief break. We'll be back after that. Please stay with us. Colin, what, based on the research, and I know you're a thinker and a doer for a think tank here, what do you see as the biggest impediments to reform? You've got a whole poll that showed reform is not only necessary, but is starting to be embraced by the general public. What stands in the way of those reforms?
I would say there's probably two things, Tony. One of which is, in some cases, legislation, giving patients that choice whether they want to use the public system or pay out of pocket at a private clinic. In some cases, there is legislation in place that is blocking that. So right now, there's a famous case in British Columbia where a private clinic is challenging this ban essentially in the courts. In Ontario, there's legislation that bans private hospitals, private clinics from doing the types of things that we're talking about. The other challenge is it comes to politics, just governments being willing to move forward with, in some cases, allowing some of these reform measures to actually happen. So those would be the two challenges. I think on the political side, for a long time, this was more of a touchy subject. It was difficult for politicians to talk about reform, but I think, 20, 30 years now, a lot of organizations and people pointing to what happens in Europe and Australia and New Zealand and other models where patients are getting better results. I think the public's starting to understand that, we can keep what's near and dear to our hearts here in Canada, and that is this notion of a universal system. But at the same time, we can reform it and end up with better results so that patients end up with better healthcare.
Yes, you raise a good point that Canadians shouldn't automatically assume that because our healthcare system is structured this way, that is the only alternative to the American system, which they know very well or think they know very well as well. So, talk a little bit about the European and the Australian experience with their healthcare systems.
Well, like I said, I mean, one of the key differences is that they give patients a choice. You're not stuck using the government monopoly. There's more competition in these countries, and competition helps lower costs. It leads to innovation, yeah, all kinds of different services being offered. So that's some of the key benefits from those countries. They also have more doctors per capita. They have more beds per capita. They have more nurses per capita because they don't just have the one system. They have two systems. So you end up with more resources. So those are, I would say, are some of the benefits from European healthcare models. Same with Australia, New Zealand. There's lots of countries that we can look at to reform and learn from. But too often, what happens is there's the political side too, and it's not just the elected. There are special interest groups that want to preserve the monopoly because it means they don't have to compete. They can pressure governments and try and get what they want. And largely, this is often public sector unions that oppose change. So they're actually holding our country back when it comes to learning from other countries that end up providing better services. So, it's a challenge politically, but I think the tide has turned, and I think it's turned actually for a little while now. That the public is there; they're ready to embrace these new changes. But we just haven't seen really the political side catch up yet.
Yeah, I'm glad you mentioned the public sector unions because that was another impediment that I was going to raise, that they can be resistors of change. Of course, if there are private sector providers, they tend to be non-unionized.
Mhm.
And so you've got that clash as well. Can you expand a little bit on that?
Yeah, I think it's in a way it's pretty straightforward. When you don't have unionized workers, then the unionized workers aren't paying union dues to fund the union. So then the union
Yeah.
gets very upset because it wouldn't put them out of business, but it will reduce the amount of money that they have to pay for everyone that works in the union. So really, it's not about putting patients first. I think it's about unions looking out for their own interests, and not even the interests of their members. Because if you're a member, you would want more choices in terms of where you could work and maybe find a better employer, whatever the case is. So like I said, I mean, really, if you're putting patients first, you want to give them lots of choices. You want a system that has competition, so that's leading to innovation. It's leading to a more cost-effective system, which helps improve the sustainability of our healthcare system. So really, I think we could be looking to Europe more at some of the things that they're doing over there. Same with Australia and New Zealand, and ultimately that would lead to better results for patients. Because when you look at international scores, we're not at the top. There's a report recently by the Commonwealth Fund, and they looked at 11 healthcare systems, and Canada came in 10th, the US 11th, and there were a whole bunch of other countries ahead of us. So why we would look at the US, I don't think it's the model that we need to be looking at. I think we need to be looking at some of these other countries that are top performers.
We're going to take another brief break. We'll be back after that. Please stay with us. Welcome back to Boom and Bust. I'm your host, Tony Clement, here with Colin Craig, president of secondstreet.org, talking about healthcare innovation and reform. And we were just mentioning off air, that's a very interesting development in Europe about their kind of quasi-voucher system. Explain that to our audience, perhaps.
Yeah, it's really fascinating, Tony, and I'm pretty excited by what they're doing in Europe, because I think it could help a lot of patients right now. It could help governments reduce waiting lists, which of course is really important because there's too many people suffering in this country. So what happened in Europe is back in 2011, they passed something called the Cross-Border Directive, and this applies to everyone in the European Union. So they call it a right, and what it means is that patients have the right to go to another European Union country and pay for surgery and then go back to their home country and get reimbursed for it. And so how it works is the reimbursements cover up to the cost that their home country would have spent. Right. So as an example, if let's say you're living in Ireland and you need knee surgery and it's going to cost 10,000 euros. Well, if you have to wait 6 months in Ireland, you have an option. You could maybe look at France or Sweden or some other EU country. And if you go to one of those countries and let's say it costs 10,000 euros too, well, you pay that. You get the surgery done there. You go back to Ireland, and then the Irish government will give you 10,000 euros. So it doesn't really cost you anything except for your expenses related to travel and accommodation. So it's not perfect. I mean, most people, I'm sure, want to get their surgery down the street rather than having to go to another country. But if you're desperate, if you're looking at a 6-month wait, you're living in chronic pain, I mean, people will do anything quite often to get that surgery. So this is, I think, a powerful tool that could really help Canadians right now, because we know Canadians are traveling all over the world for healthcare. We've talked to people that have gone to Germany, Mexico, Lithuania, all over the place, even China. I read a story recently about Quebecers going to Cuba. So,
wow.
There's all kinds of places where Canadians are desperately going to avoid our long waiting lists in this country.
That's right.
And, when people do it, if you think about what happens when people do it, they're having to spend their own money after they've already paid our healthcare system through taxes to provide services which they're not getting. So now they're having to take their disposable income, go off to another country and pay for surgery. And in most cases, they're not getting any kind of reimbursement from the government here. Sometimes it happens, but it seems to be pretty limited. But if we had this European Union option, well, then patients would have a lot more choices. Instead of waiting a year to get your hip done, you could go somewhere, right away, get it done, get reimbursed by the government. And if you think about the cost of this, because that's an important question, is what's the cost for government? It largely, it would be, I wouldn't say revenue neutral. There would be some cost, but it wouldn't be as big as people think, because what it's doing is it's changing when governments pay the bill. So instead of paying for Mrs. Jones' hip surgery next year, they're paying her a reimbursement this year. So over a 2-year period, it's essentially revenue neutral. So I think it's a good opportunity, a good policy that we should be looking at, and it could provide a lot of relief to patients right away. And one other final thing I would note about this
Mhm.
policy is that it helps those that don't decide to travel, because
Right.
again, if someone ahead of you in line decides they're going to go off to Norway for surgery, or the US or whatever, well, then you get to move up a spot in line. So there's a lot of benefits to this policy if we looked into it more deeply.
Yeah, interesting possibility there. We got less than a minute left, but it all goes to the fact that the status quo really is unsustainable, right, Colin?
I would say so. Sadly, yes. Like I said, we have even before COVID, we had a growing problem where governments were spending more and more money. We weren't seeing the results. We have an aging population, which is going to put tremendous pressure on the system in the years ahead. It already is, and every day that goes by, we have more and more Canadians getting into the age bracket where you start to really depend on the healthcare system more. So if you look at healthcare expenses by age, your first year on this planet, that's when you cost the healthcare system a lot, because your mom or dad's taking you to the hospital for lots of checkups, the cost of being born, et cetera.
Yeah.
It's a lot. I mean, no one can do anything about that, right? It's a fact of life. But then it goes down quite a bit for a long,
Right.
long time, because younger people don't cost the healthcare system a lot. But once you start to get into your 70s and 80s, that's when costs really start to go up. And so that's where we're at as a society, where these expenses are really starting
Right.
to now.
I think we're going to have to leave it at that. Colin Craig, thank you so much for sharing these results with our audience. Very interesting and certainly food for thought. Thanks again.